Welcome to another episode of Clear Light Connections, where we talk to the people behind the business of Bay Area Houston, proudly sponsored by UTMB Health. Today's special guest is Dr. Samreen, and you are with UTMB Galveston's Metabolic and Bariatric Center of Excellence. Is that correct?
That is correct. I'm the director of the program.
Tell me about the program. It's very exciting.
Yeah, so I joined UTMB in 2019, and when I started, I realized that very quickly that we didn't have a program to take care of our patients who are suffering with morbid obesity. And it's being a big, large tertiary care hospital that is serving this huge area, that sense, and this is my community, so that sense kicked in that we need to have a program that serves our patients who don't have to drive all the way up north to Houston. So we started working very quickly on to establish a best-in-class bariatric surgery program for our own patients here in the area that UTMB serves. And since then, we've come a long way. We now have a fully accredited program. So what does that mean? It's a program that's accredited by the American College of Surgeons as best-in-class program, as a center of excellence that has all the quality pieces that a program needs to take care of patients suffering from morbid obesity.
And I'm sorry, Don Sweeney, you are a patient?
I am.
So this makes it kind of very special dynamic that we have going on, and I was remiss in not introducing you.
Yeah.
No problem. I am.
So talk to me about what took you to the center. How did that come about for you?
So I've dealt with most of my adult life being heavier, and I was getting to the point where, walking from one room to another was just super difficult. And I've tried all the diets and the shots and all that kind of stuff, and nothing was kind of working for me. And my family kind of had to sit down with me one day, and it was emotional, and it was like, okay, something's got to happen. And if you ask my wife, she'd probably laugh when I say this, but I'm a very impulsive person. So when I made the decision, like, okay, I'm going to do this, I made an appointment the next day and decided to take my health in my hands and get it done.
So, and you bring up an interesting point, because a lot of the doctors that I've talked to, they go to UTMB and then they think, oh, we need this. Tell me about how willing the administration is to let you kind of take on these types of projects and create these programs that you obviously knew was needed, and you were able to convey that to them.
Oh yeah, no, they are actually extremely supportive. They saw that this is something that's highly needed. There's no other program like ours in the area, and they understood the need very quickly and were fully supportive, and we have all the resources that we need that were definitely provided by the administration.
So Don told a little bit about what, his thought process. Tell me why you do this. What makes this your passion?
Yeah, so if I may share,
Absolutely,
that Mr. Sweeney is approaching his 1 year landmark, and I do this because that transformation, that change in people's lives, and I want to make sure that people realize that this is a disease, and one of my passions and my life's mission is to make sure that our patients know that this is not something that is happening to them because they're lazy or don't have self-control. There's this false narrative that has been promoted for the longest time, and there's so much bias against obesity and its treatment that my patients are fighting. And most of them have spent majority of their life fighting this. So we seek treatment for high blood pressure or diabetes or name any other disease. Why not seek treatment for obesity, which in fact, by the way, we can prevent some of these diabetes, high blood pressure, even heart disease or cancers, and prolong the quality and quantity of life by treating obesity. So that's why I decided to pursue this. it's a disease that is often overlooked. And I did not want it to get overlooked anymore, especially not for our community.
It's funny you mention that, because a lot of the topics we've had on the podcast in the past, it's almost like in medicine where we're trying to treat people, but we're also trying to overcome stigmas. And I think that's super important to be able to do both at the same time.
Exactly, yeah. And I think taking it one step further, we're focusing a lot of times on medicine 2.0, which is treatment of diseases that come downstream. I think I want to take it to the next level of medicine 3.0, which is prevention of some of these things that come downstream. So if we can treat obesity before it leads to all the consequences of it, I think that's the next step.
So Don, tell me, you said you were impulsive, you went all in. What was it you were planning or hoping would happen, the outcome would be, and kind of the treatment plan? What were you expecting?
Well, you go into this thing thinking, I'm going to go talk to somebody, and I'll have surgery in a month and I'll be fine. And that's not the way it goes. For me, it was 8 months or so from my first appointment to my surgery date. Might have even been longer than 8 months. Because there's some things that they do to make sure that you're ready to do this. There's psychiatric appointments that you have to do. There's health appointments you have to do. I had to do a endoscopy just to make sure that my insides were good. It was a lot of different things that you do to make sure that you're prepared for this mentally and physically. So my thought was, go talk to somebody, and 2 months from now I'll be down the road ready to go, and that's just not the way it was. But
so it is a big commitment.
It's a huge commitment, and it's still a big commitment today. There's times when you go, I can have that, and then I look at it like, I've done all this work. Why would I jeopardize it now?
Yeah. So there is kind of this. It's not just physical. You've got to work on the other side of it too.
For me, I think the mental side of it might have even been more difficult. The physical side was with Dr. Samreen was easy for me. It was, I didn't have any pain afterwards. So that part was easy. The mental side was the harder part of it, especially the 2 weeks before surgery, when you have to completely liquid diet, and I've never done that before in my life, and that was mentally tough. But I'm just so glad I went through it, and I'm so glad it's paying off for me.
And I think it's interesting, he talks about this long, drawn-out commitment, and I imagine from your point of view, you need to see that the patient is fully invested in the process.
That, and that we make it safe for the patient, right? Patients are doing this to improve the quality of their life. This is elective surgery, and by elective, by no means, this is not cosmetic. Completely different. This is to improve the health and quality of life. So we want to make sure surgery is as safe as possible. And actually, we have 2 years ago at the American Society of Metabolic and Bariatric Surgery, we nationally celebrated the fact that we have made bariatric surgery so safe that it is like the outcomes are like getting your gallbladder out, same day surgery kind of deal. Even though I keep my patients overnight because that's I want to make sure that they're mentally and not just physically ready to be home. But surgery is low risk, is the bottom line of it, and we do a lot of things at the front end to make sure that we don't run into any surprises on the day of surgery. I often tell patients, we do all the planning beforehand. On the day of surgery, we just do the operation safely. We get them through it, and also the mental preparation of it beforehand. There is a lifestyle side of it. Surgery is not, we get surgery one day and then tomorrow a miracle happens. No, it's also, yes, definitely a commitment, and we prepare patients beforehand.
People like easy. This is not easy. So if you're looking for easy, think about something different.
Right. It's. I wouldn't say it's easy. It's funny. my son said something to me when I first told him I was going to do this. He's like, "Dad, isn't that kind of cheating?" And I said, "Well, if it is cheating, would you rather me cheat and be alive in 30 years from now, or not cheat and go the path that I was on?" And he kind of went, "Yeah, I guess you're right.
If you're not cheating, you're not trying."
But I think when he's seen what I've gone through, the pre-preparation, the surgery, and then the year since, I think he probably changed his mind now about like, man, that's not cheating. That was not easy. And it's not easy. It's not, you don't just, like Doc said, you don't just have surgery and tomorrow the transformation happens. Yeah. It doesn't. It takes work. But for me, it's easy in the fact that, just this past week we had Hurricane Beryl here. I was able to get out in the yard and clean up the sticks and clean up the branches and cut down tree branches and stuff. A year ago, I'd have picked up 3 branches and I would have been done for the day. Yeah. So
that's awesome,
yeah.
Don. I think I want to highlight that it's the non-scale victories. We're not looking for a specific weight. It's not the number that matters. It's how you feel. Being
Right.
able to do that yard work,
Right.
being able to fit in a plane seat or go on a ride with your child, or being able to, play with them,
Yeah.
bend down, or reach up. Those tasks that patients were not able to do before. I think that's what makes me really.
Yeah. For me,
happy.
it's walking too. My wife and I used to walk occasionally before I had surgery, and we walk over at Exploration Green over there, and I was able to do a half a lap. I would wait for her to do another lap, and then I would do the half a lap back. Now we're doing 2 to 3 miles every day, just walking and that kind of stuff. And you said a plane seat, that hit home. So I was on a plane one time, and I sat in the exit row, and I needed a seatbelt extender. And they said, "Oh, sorry, you can't have a seatbelt extender if you're in the exit row." And I had the embarrassment of getting up and moving to another seat and this past weekend I just flew this. I was out of town this weekend. I sat in the exit row and I actually had to cinch the seatbelt up. So that's, like I said, the non-scale victories. And I'm one. I don't care what the scale says. I don't care what the number is. It doesn't matter to me. It's
how you feel. Huh?
How you feel and how healthy I am.
And so, have you noticed a big change in your blood pressure? All those numbers that normally we would consider for.
I don't take cholesterol medicine anymore. I don't take blood pressure medicine anymore. Yes.
That's awesome.
Yeah.
Yeah.
Sleep apnea is another one, very common thing that patients experience. Signified by snoring. Another one is fatty liver disease, not being talked about enough. But fatty liver disease has become one of the most common reasons for liver transplant now in the U.S. And treatment is weight loss.
So it's the Metabolic and Bariatric Center. So what other services, or what's the whole thing look like? What do you do besides just the surgeries?
Yeah. So when a patient comes to us, there's 2 sides of the program. There's the surgery side and there's the medicine side. We want to make sure that every patient gets the treatment that they need and is exactly right for them. So there are some patients who probably will not be good candidates for surgery, and those patients we encourage to lose weight with medication. On the surgery, and of course that goes with diet and lifestyle changes. However, we do know that diet and lifestyle alone fail 95% of the time. We have published data on this, extensive research. On the surgery side of things, we still do lifestyle changes. We have a dietitian at UTMB now. I think, Don, when you started,
I did the online.
You did the online, yeah. But now we have a in-office dietitian. We have our patients go through psych counseling. We meet with them and kind of do a check-in every month before the surgery. There's of course all the blood work and the medical side of making sure that their heart is in good shape. We will not run into complications on day of surgery. The endoscopy that Don mentioned, and then from from there, we then talk about different surgical options. So again, one size doesn't fit all. We have to go through different options, why someone should have one specific operation and not the other kind. There are 4-5 different kinds of operations we can do, but we have to base it on individual patients.
So tell me a little bit more about the aftercare treatment, because you had mentioned that that's one of the things that kind of sets you guys apart.
Yeah. So aftercare, patients start off with clear liquid diet that pretty quickly goes to protein shakes. So first week is liquids, then starts the limited puree, then full puree diet, then soft diet. By 6 weeks, patients are eating normally. And by normally, I mean normal, healthy diet that has no sugar, high protein, low carb, low fat diet. So that's part of the lifestyle change. And then we highly encourage our patients to get more and more physically active. Of course, start slow. What sets us really apart is the lifelong follow-up. So at UTMB, we don't believe in just letting our patients, like we did the surgery and then you figure it out on your own. We believe in lifelong follow-up, because this is a disease, and like any disease, just because someone had treatment for their heart disease doesn't mean they don't see the cardiologist ever again, right? So same way. So we see patients at 2 weeks after surgeries, then 6 weeks, then 6 months, then a year, and then yearly for life.
Okay.
We keep track of their weights, their blood pressure, their vitamin levels, and of course, if there's ever a need to see us beyond the set time points, they're welcome to come see us anytime. And we provide those resources. Like I mentioned, there's a dietitian. So none of us can be perfect 100% of the time. There will be times when our patients would fall off the wagon, if we may call that. Like, there are times I'm tempted to eat things that are not right for me, and hence having those resources available for our patients, where they can talk to someone about that and get education about what healthy nutrition looks like. And the other thing we also offer is revisional surgery. So if there are situations where, for various medical reasons or weight regain happens, we also specialize in revisional bariatric surgery.
So you're coming up on your 1 year.
I just had my 1 year, this past week.
Tell me about the support that you've received. Not only from the doctors, but I guess your family, it all plays a part.
Yeah, it all plays a part. So as far as the doctor and the medical team, Dr. Samreen has the best team on the planet. From the gentleman that sits up front to the nurses and the assistants. After surgery, there's days when you just don't feel right and whatever. I'd call. You're doing everything right. This is normal. This is that's all I wanted to know was, this is normal. Like, I'm feeling this way. Is it normal? Yep. Okay, great. I can deal with it. So that I've gone through all the 2 week, the 6 week, the 6 month, and I'm coming up. I see Dr. Samreen this week for my year appointment, and as far as family, I'm going to get teary eyed with doing it. They've been so supportive and so not only supportive but very regimented with me. Like, if they see me grabbing something that I shouldn't grab, they're like, "That's something you should be."
Have they adjusted as well?
Absolutely.
Yeah,
I think the whole family has gone through the let's get healthier.
Yeah.
It would be silly for me to do all this and then watch all them kind of eat terrible, and I hate to say where I can't, but I shouldn't. And so everybody has gotten healthier. We all eat kind of the same way now. We all kind of, it's really a cool transition to see everybody getting healthier, and my wife and I getting out and walking every day, and even in this heat, there's zero chance a year ago I could have walked in 105 degree weather. And now I kind of actually seek out the hotter time to walk, because I want to sweat more, and I want to get my heart rate up and do all that stuff. So it's if you would have told me this a year ago, I'd have laughed at you.
Yeah. So the surgery is done in Galveston, but where is your main? Where are you going to see patients most often?
So our clinic is based out of League City,
Okay.
And on I-45. We have our dietitian. Our entire center is there, but surgeries as of right now are in Galveston. But
Are there plans
stay
to?
tuned. Yes.
Okay. It sounds like there's stuff
Yes.
coming up.
Absolutely, on the mainland for sure.
Okay. So it makes sense that the surgery is done in Galveston. That's the teaching part of the hospital, correct?
Correct.
Okay, and so that's where you're doing, most of the showing of the students of what they're going to be doing, hopefully down the road.
Yeah, our surgical trainees, our students and residents are there, and we do surgery with the robot, which is small, tiny incisions, 4 to 5. While we're teaching students, we're training the next generation, but also it's the team aspect, the team care. So we have our entire team that's trained in taking care of patients with obesity, which is entirely based in Galveston right now.
So you mentioned it's elective, but it's not cosmetic. Does that mean it's not covered by insurance, or is there a possibility that it can be covered by insurance?
So all depends on individual insurance plans. Depends on how where you're getting your health care from, your insurance coverage, I mean. So some plans do cover it, some plans don't. We do offer a competitive cash price at UTMB as well to help out our patients who don't have insurance coverage. I think when in doubt, the best thing is call your insurance and find out.
Yeah, it seems to me like if I'm listening to Don and I'm hearing this complete 180, and his health is markedly improved. I would hope that more insurance companies would see that as, hey, this is something that this is needed.
Oh yeah, and there are specific advocacy efforts happening nationally and at a Texas level to show to insurance companies how they can save a lot of cost downstream by covering the operation, and then they don't have to worry about a lot of the health problems that patients develop down the road. So yes, there's work happening behind the scenes on that as well. I think more and more insurance companies are also realizing that the weight loss medications just don't work. They're too expensive, and patients have to be on them for life, because once they stop it, the weight comes back, which is completely different from surgery. There's a lot of work that goes in, but 80%, more than 80% of the patients maintain weight loss at 20 years. So insurance companies are starting to realize very quickly that they should be covering the surgery.
Well, good. I hope that helps get rid of that stigma too, and it helps, like you said, downstream costs.
Absolutely.
Well, I want to thank you for being so honest and open. It's awesome to hear. It sounds like it's a complete 180. I think it's great for people to hear those types of stories and put it in their mind about, hey, you know what? I need to start thinking about that too. And thank you for all you're doing with the center and obviously teaching students to carry on the work you're doing. It's been an absolute pleasure.
Thank you for having us.
Thank you.
I think it's all success here,
it is.
and
Awesome.
I'm so glad I'm able to serve our community.